Welcome to this episode of the Marketplace for Health, Wealth, and Freedom's Medical Cannabis series. I'm your host, Jeff Cantor, and I'm proud to say that today's guest is Steve Bate. He has a very long and extensive biography. He's been doing things both nationally and globally, but it's all led to what he's doing right now with ComCan Healthcare in Florida. He's going to enlighten us a bit about his background, how ComCan came to be, and how this became his destiny. So it's going to tell us where things are going into the future, and most importantly, how you can participate for yourself, and also how you can help bring this to the rest of the United States. So with that, Steve, welcome.
Thank you very much. And I appreciate being here, and I feel great to be anywhere, to tell you the truth. About 4 years ago, I was diagnosed with not one, but two stage 4 terminal cancers. Stage 4 mantle cell lymphoma, stage 4 non-Hodgkin small cell lymphoma, which was in 39% of my bone marrow. My spleen was ready to rupture, and a friend of mine, which was Dr. Davis, had set me up with some doctor's appointments immediately. If I had waited till the appointments would have come around, I wouldn't have made it. Several more weeks, I would not have survived, looking back at it. So we went in and met with the doctors and got extensive diagnosis to find out that at the time I was, quote, not treatable. And saw a number of doctors. They wanted to put me in some experimental therapy. The doctor I ended up using said that whatever they would have done, a lot of things could have happened. And if I did survive, I may not have wanted to survive. It could have been that catastrophic as far as what it would have done to me. I went through chemotherapy, but before I did, I realized both of my brothers had been through chemo. Both of my parents had perished from cancer. So now I'm 5 out of 5 in my family diagnosed with cancer. I had previously done a bone marrow transplant for my brother at Johns Hopkins. It's been about 10 years now. And he passed away about 3 months later. Again, in hindsight, maybe physiologically, I gave that cancer back to him. I've always eaten healthy and led a really healthy lifestyle. And when it was time for me to deal with the cancer I was diagnosed with, I realized cannabis therapy would do something that made a huge difference and made the difference in saving my life and maybe other people's lives. And that was typically when you're getting a heavy dose of chemo. In my case, it was R-CHOP chemo, which was a 10-hour infusion or more. Most people, when they start, it's almost like metal is dripping off their teeth. And then they're nauseous. Then they have no appetite. And from that point on, they may never get their appetite back. They may never get their taste buds back. And a lot of cancer patients I've talked to, that's the case. In my case, when I went in, I used an extract of medical cannabis known as Rick Simpson's oil, which has been around a while. It's kind of just a phrase that's used, or they call it RSO. What it is a full spectrum extract of the cannabis. And I would take it in a gelatin capsule. It was very condensed. It's like molasses. And I start off with the size of maybe a grain of rice. And every 4 days, I would double that. But that gave me the ability to literally eat during chemotherapy. But not only eating during chemotherapy, when I walked into chemotherapy, I walked in, hello, I'm here for chemo. And they'd look at me like, wow, why are you so happy? Well, I wasn't happy. I was just glad to be alive. I mean, I realized every day was a budget, every day was a bucket day. And today is a bucket day. And every day since has been a bucket day. When I went through the chemo, I knew I had to get nutrition. And that's what I did. I drank 2 ounces of wheatgrass 5 times a week because my intestines were being eaten out by the chemo. The veins in my left arm were gone. They couldn't use those anymore. It was too late to put a port in because I couldn't heal. I couldn't go to the dentist because I couldn't heal with anything. I had to be extremely careful. But after the time and going through this, when I was done with my chemo, the infusionist looked at me and said, Steve, do you realize nobody's ever been diagnosed with the extensive cancer that you've been diagnosed, endured what you endured, and walked out alive anywhere. And that's what they said. And I looked at her and I said, yeah, with a smile. Because every day to me, whether it was chemotherapy or whatever I had to endure, was a day on earth. And I had to address it in the most positive way I could. And from that, and having gone through that, I realized with the prohibition on cannabis, on marijuana, we're not finding out what works. Do we really know what worked for me? I don't think it was anecdotal. I know what it did for my attitude. I know what it did for my taste. I know what it did for me being able to get nutrition and to stay alive. And with that, I felt we need to understand that. We need to do case studies. And we developed the company ComCan, myself, Dr. Mitchell Davis, Albert Schulman. Al was comptroller of Nationwide Insurance. He understands healthcare. And here's our company ComCan. And we founded that for the purposes of doing true medical cannabis care. Dr. Davis founded along with Al Schulman and myself. Now we've brought in Dr. Rick Wayback, and both of them have degrees now in medical cannabis. We've had thousands of patients. We've saved over 1,000 patients this year. We've helped them with their medical care. And we've also been chosen as at this point in time, the first medical cannabis healthcare company that can do basically personalized cannabinoid therapy, where we identify what the issue is and look at the solutions using the different cannabinoids that may or may not include THC. It would include the terpenes or the cannabinoids that have been effective in different types of diagnoses. And the different diagnosis would really determine how you're going to treat each individual, which is very different than just getting cannabis and using it. What type of cannabinoids do you use? And in looking at the true medical capabilities of what endocannabinoids can do, we're just now scratching the surface. So what we've been able to do is help thousands of people. We want to work with other doctors and with the patients to educate. At this point in time, I feel the most important thing we can do is education. We're working with legislators in Florida and nationally to change legislation that can make a difference as far as medical cannabis care, the way it's looked at, the stigma of medical marijuana or medical cannabis, and also looking at treating other things such as opioid addiction. Currently, the way opioid addiction has been treated is with methadone or Suboxone or gabapentin. What the research shows is it hasn't been very successful. Maybe a 92% recidivism, and there's a lot of overdoses. Mm-hmm. Both people that have been brought back with Narcan or overdoses that are death. I know where we're at in Delray, there were over 600 overdoses last year. How many resulted in death? A lot of them, especially during COVID, where they couldn't be administered Narcan or people wouldn't touch others to help them in a situation like that. Knowing that that works as it does, in Canada, which is now legalized cannabis, they did a program with 1,000 opioid dependents where they were able to reduce 97% of their opioid usage, and over 50% got off of opioids and stayed off for over 6 months and without withdrawals or without the typical withdrawals that they say. And that's something that we've looked at as far as treatment. Unfortunately, billions of dollars are spent on opioid treatment. We're the only country in the world that has the crisis with opioids that we've had. And cannabinoids can be very powerful in helping that. The cannabinoids can overpower the opioids in helping treat people, whether it's people that were on it because of using it for a drug, for an addictive drug, or people that did it because of their treatment in an accident or in pain care. Either way, cannabis can do a lot more, and it's not toxic. It's not lethal. Nobody's ever died from an overdose of cannabis. But we still have the stigma. We've had the prohibition. And first of all, we want to change the stigma. But most importantly, we want to address professional medical care to treat patients like myself. I did it on my own by educating myself best I could. I don't know what worked in that, and I don't know that anybody knows what worked in the concoction that I took, but we need to define that. Dr. Davis, one of my two partners, spent over 20 years in doing case history with hepatitis C. So he understands applying case history to individuals to help develop a drug. A drug was developed by Gilead that nearly cures hepatitis C. But we like to approach our medical cannabis in a way that is done as case studies, done in a way that true medical health care addresses the issues. You look at the veterans, 22 of them are committing suicide a day. Most of those are on opioids and antidepressants. The statistics show that about 93% of those have asked for medical cannabis. They're not able to get it through the VA. They're not able to get it as a veteran or an active duty person in the armed forces, but they'll give them plenty of opioids. I've had veterans that have come and said, Steve, can you talk to the Veterans Administration about giving me cannabis? I get all the free opioids I want. I don't want them.
Right.
The disabled veteran, they're paying for everything. The house, the utilities is told, everything. But they will not give medical cannabis or even CBDs for that matters. And the problem is a lot of them are scared that they'll lose their benefits because of medical cannabis. And a lot of them are buying on the black market, and they don't know what they're getting. And that's a whole nother issue. So you look at true healthcare, you look at logic, you look at common sense. That's what it really needs to come down to. This is the only issue that I look at that's a true bipartisan issue. This isn't a Republican or Democrat issue.
Well, it's indicative of the way you came to. It's indicative of the way you came to it, because you weren't like looking to have a dog in the race or anything. You had a problem and you wanted to solve it, and you came up with a solution. So you came in the most unbiased way to this epiphany, which is important to demonstrate.
And I look at this as an altruistic reason to get involved. My first job was working in Congress. I'd like to go back to Congress and sit down and say, Democrats, Republicans, come together. Let's do what's right. Let's take care of the veterans. Let's take care of the people that have opioid dependencies. And let's take care of people that could really use medical cannabis the way it's meant to be used. Let's understand that. And let's save money. Let's do proactive medical health care as opposed to crisis management. I had to do crisis management. And I may be one of one that was diagnosed with what I was diagnosed that's alive. So I'm here to let people know. My first occupation out of college was working as a legislative aide in Congress. And I was able to accomplish a number of things. I was one of the founders and designers of the U.S. Holocaust Memorial Museum in Washington. And I think we brought some insight to people on how anybody could condemn anybody, for that matter, other humans. And in a way, people have been condemned for cannabis since 1934. This prohibition that's gone on has condemned a lot of people.
Reefer madness.
The reefer madness was done almost in a racial slur to identify those that were using cannabis at the time, but it was really identifying individual groups that they could target in a manner that, in hindsight, was not right.
No.
We look at the Holocaust, it was not right. How can we condemn others when we need to be logical? We need to use common sense. And none of this was common sense. The common sense now is to evaluate what works. When Eli Lilly had drugs in 1890, they were working on cannabis medication. They thought that the plant had a lot of efficacy as far as extractions for medical care. We're still not there. We have not defined what the extractions in cannabinoids can do best for different individuals with different needs.
As you've demonstrated and has made the point, which has become very obvious, is that education, research are critical to be able to move this thing out of the closet. But at this point, for those that may not be in the know, what's the one obstacle that's preventing any and all of that from occurring? Is it not that Schedule 1 situation?
Federal Schedule 1 that says that cannabis, marijuana, has no medical effectiveness whatsoever, and therefore is a dangerous drug, scheduled the same as LSD and heroin. We know that, I know that. It's not even an addictive drug. It's not a physically addictive drug. Alcohol is much more dangerous. Nicotine is much more dangerous. But managing the different cannabinoids, when we talk about THC isn't always what is effective in a lot of cases. Mm-hmm. Understanding that. You don't have to get high to have medical cannabis care. As a matter of fact, that has nothing to do with medical cannabis care.
Not at all.
It has to do with treatment and the efficacy of what works for different diagnoses.
With your ability to do that now, is it still some level of experimentation because there's not a good solid research? You just try different combos and see what kind of works, or do you have more of a science of it now?
No, you still have to understand the individual, and there hasn't been enough as far as studies. There hasn't been truly identifying what works as it should and isolating that. And as far as patients, the biggest thing we have to do is educating patients, that this is not something dangerous, that you can get off your Percocet and use some of this, and the Percocet was dangerous. This isn't dangerous. But you really need to understand what they're taking and monitor it, just like someone that's going to take insulin. What they start off with may not be what they're using a year later, or 6 months later, or even 6 weeks later. So it's really understanding and managing what works best. And, we always say, slow and low, start slow and use a low dose to find out what's going to work. The last thing you want to do with a patient is for them to go, get a medical cannabis card and go to a dispensary and get something that's the wrong mixture. And we don't know that till it's too late and they have a bad reaction. That's not good. And in order to really manage that properly, you have to have an interactive relationship with your physician to know that what you're taking is dealing with your medical ailment and managing that. There really hasn't been managed care in medical cannabis. And
a lot of managed care for that matter. It's very blanket. And that's really kind of where the newest reality of medical care is going, is the idea of completely individualized health care. And this definitely lends itself to that. With what you're doing, are you growing mostly by word of mouth, or is that kind of how people are finding out about you?
There's two ways. We're growing by referrals from patients that have been incredibly happy. We have well over 100 ratings. Every single rating that we have is 5-star. We've had nothing but 5-star ratings.
Phenomenal.
In every case. And we've had, this year we had over 1,000 patients. And yes, it's individualized. It's different for each individual. What one person is going to have and the reaction they have to those cannabinoids is going to be different to every individual. So like any type of medicine, what one person takes is not going to work for everyone. And everybody has a different physiological makeup. And that's where you identify it. And, we grow, we change as we age. And that's another thing in understanding the different regimen that you're going to have as far as what you're using. Unfortunately, it's not accepted because of the Schedule 1. The doctors that recommend have a conflict of interest if you're not just doing medical cannabis care, which we are. Our physicians are focused 100% after of medical cannabis care. They are both nationally recognized physicians, but they're focused 100% on medical cannabis care. And I feel like we're not only the best at what we're doing, we're the only ones that are really doing what we're doing and addressing it in the manner that we are.
I was just going to ask you, are you the only operation in this dedication, that focus, or are others starting to mimic what you're doing?
No, I think there's a number of physicians out there that are truly knowledgeable and truly understand. But as far as trying to create a compound specific to each individual, we're really the first ones doing that right now.
Awesome.
That we know of. I know in Israel they've been doing it. Dr. Raphael Meshulam, who isolated the cannabinoids in the first place, has come up with a lot of response to how we address medical cannabis. One of the statements he said is if there's a 10% variant in medical cannabis based on the compound or the plant or what you're taking, it's very difficult to manage care when you have over a 10% variant.
Right.
When we look at the plant itself, one part of the plant may be different than another part of the plant. But when you're doing the extractions and you're dialing down the different cannabinoids, then you're in a specific realm as far as what that extraction is, the milliliters of that extraction or the different compounds that are in it, which is very different. As far as the needs for individuals.
Sure. With what you're doing and you're mentioning Israel, are there any other areas around the world that are kind of into this zone, or you're still that much out front of everyone else?
Well, I think there are a lot of people all over the world looking at this. Obviously in Canada and many other countries, they're looking at Jamaica. They finally legalized Jamaica. They have a cannabis licensing agency. Unfortunately, the people that had been involved in America, because it's federally illegal, they couldn't go to Jamaica because they wouldn't pass Interpol as far as legal. They broke a federal law in America, even if it's legal by the state. And when you look at, for instance, looking at the veterans, and we were going to talk about, well, they can get what they want in their state. What if they travel? I'm from Indiana. There's still no medical cannabis in Indiana. You can still be imprisoned for a year. So let's say a veteran goes there and they have an extract. It might be a felony there because it's an extract. The laws are different in every state. And we don't sit still. I mean, unfortunately for COVID, we stayed at home and we didn't travel. But, this is a very active country. It's a very active world. And to be able to travel with your medicine is fairly important. If you can't take your insulin with you and you're a diabetic, you may die.
Right.
And I've had childhood diabetics that have said to me, Steve, I'm in a place where I'm not allowed to have cannabis, but it's saving my life because after dinner, they'll take a little bit of cannabis that reduces their blood sugars enough, and they may have a pump where they didn't get another shot of insulin, so they didn't have to pay for the insulin, but they're also breaking the law. They're like, Steve, I'm saving my life and I'm a criminal.
Right.
That scares me. And it hurts me that you could be a corporate executive. You could be anybody, but yet if you're using cannabis, you're a criminal in a lot of places.
Right.
Still punishable by prison. And
again,
that's all the people over the years that have been imprisoned.
Sure.
For a small amount of cannabis.
Well, that and even worse, like you described, look at all the people that died for one reason or another because we've ignored the common sense of what this is showing itself to be, and somehow everybody's married to this position. So in terms of that moving, are we having some progress there as far as getting that off Schedule 1 to open this up a little better?
Well, I think the people in Congress are looking at it. I think everybody wants to take credit for it at some point, but at this point, it really needs to be a collective group, Democrats, Republicans coming together. It may be the best thing for the country. We're doing something that is bringing everybody together. The majority of America want medical cannabis. I think the
Yes.
percentage of people that accept it is over 85% at this point.
And at all age levels too.
The average age of most of our patients is nearly 70 years old.
Wow.
When you exclude the autistic children and epileptic children. Now, in the case of anybody under 18 to do any type of cannabis therapy, they need 2 doctors to evaluate. But we've had autistic children that would come in and be beating themselves up, sticking their head in the couch, making all types of noises, and coming back a month or so later, walking in, you wouldn't recognize them. Walking, hello, Dr. Davis, how are you doing today?
Wow.
Unbelievable. And we've worked with the Autistic Society. I had a radio show called Cannabis Conversations for a while, and we had a lot of different people on. Had someone that talked about their child who was an epileptic, who was on prescription drugs, and they would still have seizures on their prescription drugs. Every month or so, they'd still have seizures. They said they'd been on medical cannabis, haven't had a seizure in 2.5 years.
Amazing. Amazing. So here's a very important part of the questioning. For the people that are listening that think, well, if I need this, I can kind of reach out, obviously, to you guys or get some direction. But for those that don't think they need it themselves, maybe not yet, or they do know others in their family, what can they do to get involved to help move this legislatively or locally or communally? What can an average person do to help further the cause?
It all comes down to U.S. Congress. The states have done a lot. The people in the states have done a lot. But it really comes down to a national effort. As I said, you can't move from state to state. The laws are all different. We need a standard. Mm-hmm. And we need insurance. We need affordable cannabis care. I look at our patients and they're fairly wealthy. The people that need cannabis, a lot of them can't afford it.
That's right.
And there's no avenue right now for them to get it.
Right.
I was very fortunate that I educated myself. I saw what my family had gone through, what my brothers had gone through, and I realized it's nutrition. But if you have no taste buds and everything tastes like metal and you're depressed and you can't get out of bed, you're not going to get much nutrition.
No. Are there any national organizations to participate in, or do I just lobby my local legislator?
Well, the American Society of Cannabis Medicine is one that's a group that it's great to join, but the American Council for Cannabis Medicine, which I'm now the ambassador for the state of Florida, has been working nationally to, first of all, educate people, to work with legislation to change Schedule 1, to work with insurers, to work with medical providers. You go to universities, you go to medical schools, they don't teach the doctors about cannabis.
No.
They do not know. There's no education. As a matter of fact, in one of the medical schools, when they got to pharmacology, it listed cannabis. It said a federally illegal drug. That's all it said. But it broke down, all, Percocets, volumes, everything else. And there's components within cannabinoids, CBN, for instance. Several drops of CBN may be equal to the Valium that you took. Well, Valium could be toxic.
Right.
And based on some of the studies, it worked better. Same thing with CBGs. They're saying now THCV, which is legal, which does not create a psychoactive or effect to make you high, working for Parkinson's. And believe it or not, it's working for diet. The last thing people think of with medical cannabis is that you're going to be able to use it for diet. Usually use it to enhance your appetite, but the THC is working for diet. So as we learn more, and a lot of it's isolated studies because you can't do a case study. You're not going to be able to do a study with the AMA. Someone that's doing regular medical care that's doing this on the side, but they're taking insurance for that visit. How can they take insurance and say, recommend, quote, a federally illegal drug?
Right.
It's a conflict of interest.
Totally.
So how can you do medical care and talk about it with your physician? So getting back to our referrals are coming from existing patients and doctors. We have over 70 doctors now that are referring patients to us. And as I said, we're getting nothing but 5-star ratings. And when people come in and say, my God, I haven't golfed, I haven't danced for 3 or 4 years, I'm doing both. And their quality of life is so much better, they're getting sleep. And that's a whole nother issue. The extracts that are best for sleep. The luxury
the luxury is everybody that you're able to help. I mean, it becomes pretty much a list of everybody from every age bracket, every socioeconomic background. It doesn't really matter. Everybody that's got something going on is going to find some way within this world to be helped.
Well, it's proactive. Jeff, it's truly proactive. The medicine we typically do is crisis management, like a lot of things.
Right.
And you can look at
never make good decisions in a crisis.
Well, it's interesting. You look at what's happening with COVID, and you look at some of the CBDs reducing inflammation. Mm-hmm. Well, there's an inhaler, I think, that they've put in ventilators that have reduced some of the COVID cells and brought people back. And I think, there was a study in Canada when COVID came out that some of the CBDs will reduce inflammation in the esophagus and in the lungs to help with people that have contracted COVID.
It's just interesting to see what we're going to discover when they allow this stuff to move forward. It's going to be really very exciting. I mean, you mentioned a lot already, but it's literally just scratching the surface on what's going to be found out. What's exciting about today is demonstrates what you're bringing forward, and also to indicate to all the outsiders it's time to get off the fence. You need to help participate because one day you may need this, and somebody in your family probably already is benefiting. Some you may not even be aware of. So on that note, Steve, I want to tell you this has been a fantastic interview, and I'm so glad you spent some time with us today.
Well, I really appreciate it, Jeff. And one other thing you mentioned is when you said people may not know they're doing it. People don't tell people they're using cannabis. I know they did a study and asked people that were advocates, if they told their doctors that they had used cannabis. Less than 50% told their doctors. And those were people that were advocates of medical cannabis or cannabis per se. And that's even scarier when you can't even admit that it's working or that you're utilizing it.
No, it goes that
self-medication or whatever.
It totally goes that stigma and that fear that you described, which would all dissipate if we could take that thing out of the shadows. So definitely, again, thanks so much for today.
Jeff, you're very welcome, and I'd love to make myself available. I can't wait to walk up to Congress and figuratively grab the members of Congress by their lapels and say, listen, folks, this needs to happen. It needs to happen now.